So first of all, before giving any procedural sedation, we have to classify the patient depending upon his physical health and comorbidities, so that we can plan accordingly and we can give sedation according to the patient condition. Right? There are 5 classes of American Society of Anesthesiologists. We call it ASA classification: 1, 2, 3, and 4 and 5. In class 1, patient is normal healthy patient without any comorbidities. Right? But in class 2, here our concerns start from class 2. Patient has mild systemic disease, but that is well controlled. Like patient has comorbidities of diabetes, hypertension, angina, asthma, but they are well controlled, and patient is also compliant with the medication. Then comes class 3. We keep on adding adverse feature, like in class 1, normal healthy patient; in class 2, with mild systemic disease; in class 3, that is systemic disease that is not controlled. Okay, in class 3, patient might be having diabetes, hypertension, and other diseases which can affect his respiratory or cardiovascular system as well as CNS. So patient might be having diabetes, hypertension, asthma that is not controlled, poorly controlled, multiple episodes of asthma, multiple spikes of hypertension and sugar level. So we have to be very cautious in this patient. Then comes class 4, that is a severe systemic disease. In this condition, patient is having a constant threat to his or her life. So if we do not act promptly, patient may lose his precious life. Right? So the example could be OBS patient coming with eclampsia, right? Abruption. That could be the case. We have to remove the sinister, that is placenta. And then comes class 5, that is a moribund patient. So prognosis is not expected. Either you do surgery or not, patient is not going to survive more than 24 to 48 hours. So it is quite simple classification. We keep on adding one adverse feature: normal, controlled, comorbidities, uncontrolled, severe, threatening to life, and moribund. Then comes level of sedation. This slide is very important as compared to previous slide. They will give you a scenario. Sorry. They will give you a scenario and will ask that we have given this drug to the patient, and in this patient doesn't need any intervention in the air. His ventilation is compromised or not, his CVS is compromised or not, maintained or not. So you have to classify the level of sedation in the answer. So we have basically 4 levels of sedation: minimal sedation, moderate, deep, and then comes general anesthesia. In minimal sedation, what we do, we give anxiolytic drugs to relax the patient, like intranasal Entonox, morphine. So in this case, the patient response is normal to verbal communication. Patient is having proper normal communication with the attending physician. Airway, ventilation, and CVS all are unaffected. So we do not need to worry about that, and we can do this type of sedation in emergency department. Then comes moderate sedation. In moderate sedation, we can give opioids and benzodiazepine. It is a level 2 of the sedation. Here the response is purposeful. Patient is relaxed, patient is dizzy, he may go to sleep, but when you talk to them or you touch them, they respond to you. Okay, airway is usually maintained in type 2, moderate level of sedation, and ventilation, patient is breathing on its own spontaneously. So we mostly don't need to give additional oxygen to the patient or maintain the ventilation. CVS is also usually maintained, no changes in hemodynamics. Then comes deep sedation. Just give me a second. Okay, then comes deep sedation. In deep sedation, we take help of the sedative drugs, right? We can use propofol, we can use ketamine as well. We can also use other drugs, thiopentone or etomidate. What happens when we give level 3 of the sedation? The response is purposeful following repeated or painful stimuli. Patient goes into sleep, sometime into apnea as well. So patient goes into sleep, so you have to repeatedly intervene or give a stimuli, then patient would respond. So patient in this case can go into apnea, so patient cannot breathe on its own. So we have to intervene the airway, we have to maintain the airway. Ventilation in this patient may also be spontaneously breathing. So sometimes when you have given these drugs in lesser doses, then you do not need to give ventilation to the patient. Patient is breathing on its own, and CVS is usually maintained. Then comes general anesthesia. Then in this type of sedation, patient will not respond. Patient is unarousable even with painful stimuli to the knife of the surgery. Patient would not be responding because here patient is sedated as well as paralyzed. Okay, patient cannot breathe on its own, so we have to maintain the airway with definitive airway, ETT, or supraglottic airway devices like IGEL and LMA. Ventilation, patient cannot breathe on its own, so we have to provide the mechanical ventilation. Okay, CVS may be impaired because of the effect of drugs affecting the hemodynamics of the patient. Some drugs can stimulate the CVS, raise the blood pressure and heart rate, like in ketamine, or some drugs can depress the heart or cardiodepressive, mostly in fluid depleted patient. When there is no fluid in the vessels, you will give propofol, then there would be venodilation and collapse of the CVS, like patient may go into hypotension. Okay, venodilation, what it will cause? It will cause decrease in systemic vascular resistance, would be pooling of the blood in lower limbs. So return of the blood would be in lesser quantity. Systemic vascular resistance is less, then the blood coming from the superior inferior vena cava would be less preload, that means less cardiac output, that means less blood pressure. So patient will go into hypotension. So you must be aware of these type of sedation, and they give these clues. Patient is responsive to painful stimuli, patient is arousable, patient is not responding, ventilation is inadequate, no airway intervention is required, and then you have to pick the answer accordingly. Clear so far? Or do I need to repeat anything? Did we complete? Yes, we had completed RSI in previous session. We had discussed 6 P's of the RSI. So in a short time, I can summarize it for you if you want.